I spent some time with the startups here just a couple of minutes ago, and to be honest, I was blown away. And on the one hand, you hear Darren talk about these huge challenges in healthcare, and they're huge. Just to give you some perspective, in the US, the healthcare spend is about 18% of GDP, which is about $3.2, $3.3 trillion. The waste in the system is about a quarter of that. And what is waste? Disease that could have been prevented, unnecessary test procedures, no care after people leave the hospital. And now we see all these opportunities, but there are also challenges to get it into practice. I think that's what we're excited about, because we're here as an ecosystem. It's not just great startups, it's Philips, it's customers. So we have people from university medical centers here that are as excited about what the technology can do for us as we are. We have customers here that want to see it in their daily practice so that they can care for their patients better. And what I've seen is short of mind-boggling, because this is a relatively young technology when it comes to wide practice. And if I see what it can do to healthcare, I think it's nothing short of revolutionary. So what we've seen today already is the ability to be much more precise in the diagnosis, to not be dependent purely on what you have learned as a doctor or a radiologist or a nurse or a patient, but be augmented by that technology, pinpoint information, compare with others, highlight where the issues are, quantify so that we can compare. So a more precise diagnosis, and no longer just from one modality. So we can look at an X-ray or we can look at an MR. But what if we can look at an X-ray, and what we've seen today is use the CT scan as a ground truth and work on that? What if we can make that one perspective, but start looking at multiple perspectives, not just what we see on an image, what we can see in the digital pathology, what we can see in genomic code, what we can see in behavior, and use that to create that very precise view of who you are as a person, what your health drivers are, what your chances of getting a disease, what the probability of getting you back on track is. I think all of this we can now start doing with AI. And why is AI different? There's something profoundly different from earlier technologies, and it's really profound. It's for the first time we have a technology that can actually learn. We've always instructed the computer to follow the instructions that we gave them, the if then else. And now there's a technology that can learn, that can be supervised and learn with every procedure, with every diagnosis, with every therapy. It can learn, and that knowledge can be accumulated and then made available around the globe. So I talked to doctors in China who said our goal is to provide the same quality of care in our top hospitals in Beijing and in the countryside of China. There's absolutely only one way we can do that. That's by codifying the knowledge that we have and make it available in the hands of the doctors in a community hospital in rural China, in the hands of a patient that wants to understand what their symptoms mean, what the pain in the chest means, their swelling in their ankles mean, and guide them to the right content, and if necessary, guide them to the right doctor, who can then glean information about that patient, compare it to hundreds or thousands or millions of others, and come with the right diagnosis at that time. Already, we can see in images much more than a radiologist has ever seen in the 100 years that radiology was a medical practice. We've seen that exponentially growing. So what we know today, what we've learned today, is only going to be a fraction of what we'll have in 5 to 10 years. And if we think about what that means for the practice of medicine, what that means for science, but most importantly, what it means for us as people. I think the change we're going to see in the next 10 years is going to be profound. The impact that we can have together is going to be profound. And I think it will only work if we bring together great university medical centers, great doctors like Mark van Boeghem, who will do the keynote here, great researchers, great entrepreneurs, great data scientists, and we work together in a smart ecosystem. Because Philips used to be about products, and then it was smart products, and now it's solutions that bring together products and services in a whole. But it's going to be about smart ecosystems, because we understand there's no person, no company, no organization, the greatest doctors in the world cannot do this on their own. We got to do it together. And I think that's what we're celebrating today. We're celebrating, I would say, almost the birth of a completely new ecosystem in healthcare. And I think all of you are present here to experience that today, to tap into the energy, the knowledge, the drive of those entrepreneurs that I met earlier today, combined with the size and the scale and the access to care processes that Philips can offer, together with the university medical centers that can work with us on the validation and the integration into medical practice. And I think together we can truly move the needle. Together, we'll see that today was a special day, because on this day, we proved that we started on the road towards a better healthcare, where every one of us can look back and say, yes, now I understand why I feel so much better now, why my dad is in better control of his disease, and I know now that my kids will grow up in a healthier world, and we will all be part of this. Thank you for being here, and have a great afternoon.